Basically out here we're a role 1. So we're kind of this first line of defense, if you will, after the regimental medics that are out there with the cadets. To prepare for any medical situation, essentially my 68 Whiskeys or my combat medics, they're going through training. We've been training out here at the Role 1, practicing like a cadet comes in the door, we assess their injuries, get them checked in and seen by the provider, and then kind of practicing any scenario that could come our way in regards to what kind of injury they have and whether or not we're able to handle it in our setting. This is what we call a Role 1. So essentially we have limited capabilities when it comes to major traumas. Our main goal out here is to treat musculoskeletal injuries, lacerations, poison ivy, rashes and burns, things like that. But any sort of major trauma, we're trying to send immediately up to a higher level of care.
So once we treat them, we decide whether we can keep them or not. So the first option is if it's a smaller injury and they can go back in the fight, the doc will make that call and we put them back in the fight. If they need to be held, we can hold them up to 72 hours and we can put them back in the fight. But if we can't hold them and they go to the next role of care, we basically document everything, that treatments we gave them, the injuries that they had, and then we stabilize them and push it forward to the next one. The treatment just starts with knowing what the injury is first. So we go through a whole list of mechanism of injury, treatments for that, and we usually always have a doc with us that would monitor but let us do the work until we don't know what we're doing, then he will step in. Our biggest honesty capabilities is that we're close enough to a higher level of care to where our sole job really is to make sure that these cadets are stabilized before we can hand them over.